There are many sports that involve stopping and starting, whether it's football, soccer, lacrosse, field hockey, tennis. So there's lots of sports that involve, sudden shifts in direction, stopping and starting. And with those come various groin injuries, groin pain. So athletes with groin pain typically have one of two things wrong with them. They either have an injury to their pubic symphysis or the pubis, or they have an injury to the hip. So I would really recommend, if a person in one of those sports, or an athlete, in another sport who has hip and or groin or inguinal pain, that they get an assessment by a doctor who does prolotherapy. It's actually very easy to distinguish the two. Typically, people who have a pubic symphysis problem just have pain over the pubic symphysis. So the doctor just needs to evaluate the pubic symphysis, and if there's tenderness right on the pubis, then that's the problem. Athletes don't often realize there's a lot of structures that attach to the pubis. There's like 8 different kinds of tendons, muscles that attach to the pubis. Then there's various ligaments. The superior pubic ligament attaches there. The pubis itself is a disc. The pubic symphysis is a disc, so that disc can get disrupted. So when your pubic symphysis is loose, and I'll just show an illustration. This is the pubic symphysis, so you see the disc here, the pubic symphysis disc. So there's all kinds of tendons and muscles that attach on the pubis, like your abdominal muscles. All your abdominal muscles attach to the pubis. So it's very common to have lower abdominal pain with a pubic symphysis injury. Prolotherapy is great for pubic symphysis injuries. It's at least 90% successful getting the athlete rid of the pain and back to their athletics. Now, if a person's not tender over the pubic symphysis, then the doctor, of course, would evaluate the hip. The kind of hip injuries that a prolotherapist sees typically is one of 2 types. They have a labral tear, or they have a hip joint instability because one or several of the ligaments of the hip is injured. So the doctor can often tell that just by a physical exam, but patients often know it. If you move your leg like you move your hip, and you notice that the hip joint's clicking, then you have joint instability. Joint instability is treated by prolotherapy. I would say the treatment of choice, especially for an athlete who's in a running sport, is prolotherapy. Hip joint instability means you either have a ligament injury or a hip labral injury. Now, incomplete hip ligament injuries, which is most of the ligament injuries in the hip, you cannot do surgery for, so you have to do conservative care. So the best conservative care that will get the athletes to the playing field quickest is going to be prolotherapy. So if you have, you got clicking in your hip and it's affecting your performance in your sport and you have pain, you definitely should go see a prolotherapy doctor. If you have a hip labral tear, you can get surgery or you can get prolotherapy. Obviously, I'm biased. I would recommend getting prolotherapy because when I see arthroscopy reports on athletes, especially young athletes, almost all the time, whether it's a meniscal tear or a hip labral tear, the arthroscopy reports show that the doctor, the orthopedic surgeon, removed some of the labrum or some of the meniscus. So the short-term solution is great. Like if you remove the injured part, you don't have clicking, popping, the pain goes away, but long-term the results are terrible because you're going to end up with progressive or aggressive arthritis. So it means that you've now made actually the hip joint unstable long-term by removing some of the tissue that stabilizes the hip or stabilizes the knee. The knee joint and the hip joint, they need the knee needs the meniscus and the hip needs the labrum. You need the labrum to protect the joint and to stabilize the joint, so when an athlete runs, the hip sockets, the ball and socket stays in place. So Without the labrum there, the joint isn't as stable. So what happens is then there's excessive motion in the joint, so then that deteriorates the articular cartilage and the athlete ends up with arthritis. So that may not, worry you now, but me as a doctor, I feel like I have an obligation to you short-term and long-term. Short-term to help you get back to your sport right now, but I have a long-term obligation that you're going to be able to play the sport for life. So if you want to play the sport for life, you better get prolotherapy instead of getting arthroscopy or orthopedic surgery, because I'm telling you, unless you have a complete ligament tear, if you get arthroscopy or orthopedic surgery instead of prolotherapy, it's going to significantly decrease your chances of being able to play your sport for life. I'm telling you that as a fact.